Well, COVID and flu are spreading around the country after the holiday gatherings and, of course, travel.
So far, 5 children have died from respiratory illnesses and 47 adults. CBS 17's Liz Ortiz is here now with a closer look at the impact. It seems like everywhere you go or you talk to people and somebody's sick, you know someone.
Yeah, everybody is getting sick this time of year. Rod, Angela, hospitalization rates are about the same as they were this time last year. But the CDC says it's keeping a very close eye on how the healthcare system is dealing with the increased strain.
New year, same worries as COVID hospitalizations nationwide are at the highest level since last February.
It's concerning in the sense that the volume of patients is higher.
Nationwide, emergency room visits are up 12%, and deaths are also on the rise compared to last week.
They are sicker, especially the patients that are the most vulnerable, that have comorbid disease, things like cancer or respiratory disease.
And it's not just COVID. Doctors also seeing more cases of the flu and RSV. 31 states, including North Carolina, are reporting high or very high levels of various respiratory illnesses. The uptick leading hospitals in several states and Washington, D.C. to bring back masking requirements.
It really helps to protect the vulnerable people that are sitting out there in the waiting room right now.
The CDC says one contributing factor to the rise in illnesses is people haven't kept up with vaccinations. Fewer than 50% of adults are vaccinated for the flu, even fewer for COVID. With cases of all three likely to have spread as people got together over the holidays, health officials say pay attention to coughing, fever, or fatigue.
If you are getting sick, one of the best things you can do from there, in addition to taking care of yourself, is limit how many other people you expose.
In other words, stay at home if you can.
And according to CDC data, 6 flu-related pediatric deaths happened nationally in the last week of 2023. Guys.
All right. Liz, thank you.